Allegra, I'm 47 years old, and my boobs are bipolar. I've got the good girl and then the diva who doesn't want to do a damn thing. I naturally have a dual-sided personality. I am a sensual woman, and I just love the extreme aesthetic. But I'm also a prodigy on the piano. And when I was about 6 years old, I started studying at Brigham Young University with a professor there. My life has always been a dichotomy. I'm a freak of nature, willing to try anything, but I'm also a wife and a mother and a homemaker, and I love my family. My husband, now Dyson, always fantasized about having a wife who had huge breasts. He loved Pamela Anderson, had a huge crush on her. And so at the age of 33, I got my first breast implants, and they were 800 cc's. People would notice, oh, you have nice breasts, they're full, they're lovely, but I was getting that boob greed a little bit and wanted to be fuller, bigger. And I found a website where it would bring men that wanted to financially support women that wanted implants, and they would buy picture sets, request certain things for a certain dollar amount, and the site would cut the check to the doctor, and you would just go and get implants. The doctor said he would comfortably put in $1,700. When I got the second surgery and I woke up from that, I felt like an elephant was on my chest, and I'm getting giddy talking about it now. I loved it, but still wasn't as big as I wanted to be. So I found out about a doctor that did tissue expanders where I could expand with saline and grow my implants. I love being in control. And I love being in control of my own breast size. I was able to double the size to 4,000 cc's in about 5 months. I am at 4,600 cc's. I definitely use the gym to strengthen my back and keep my core strong so that I can hold these girls up. I actually have 20 plus pounds of weight vest on, but it's the cutest weight vest you've ever worn, I promise. After the expanders were put in, I did notice that my left side sat a little bit higher and was firmer. The more that I increased the size, the more it became apparent. So what I would love for the doctors to be able to do is fix the asymmetry. I'll be the poster child of extreme surgery, but still wear it well. And that has been my whole mission all along anyway.
All right, my dear, are you ready?
I'm ready.
Ready to see the Hollywood Hills?
I like to think of them as my Golden Globes.
Let's commemorate this moment in time forever. God, those are beautiful.
Aren't they? They are so, thank you.
Yeah.
I'm really excited to see the doctors, and I wanted to cast my breasts and take it to them, so I'm sure they're gonna love it. Guess I can help you cut the strips.
I'm sorry, I'm not hearing anything you're
I'm
saying
not
right now.
really even listening to what I'm reading, so it's fine. I'm just enjoying this moment.
Doing the cast is really fun because I get to, massage my wife's breasts for 30 minutes. So, it's a win-win, I think. Amazing.
Yeah, I'm glad you like this. I thought you would.
This is artwork.
Well, that's kind of how I looked at it. I may not be everybody's type of art, but you appreciate it as much as I do, if not more.
No complaints here. You are my muse. Gotta go in to your cleavage. Wow.
The chasm.
The pit of despair. No, actually,
Yeah, I was going to say, I don't know if it's the pit of despair. I think it's
the pearly gates.
I would love for the doctors to be able to fix the asymmetry. It really doesn't matter which one is which. If I could get the easygoing girl to be lifted up a little bit more, or the diva to just settle down into her little space and be happy, it would really help me know that I've refined my breasts as much as I possibly could.
This one's more of a football, and this one's more basketball.
Yeah, exactly. Both your favorite sports.
Yeah, two favorite sports, yeah.
Memory made. Let's go see what the docs can do.
All right, we have a patient named Allegra who has had 3 breast surgeries and is having problems with them. Let me show you. Hello.
Those are bigger than basketballs.
I mean, I don't know.
I wonder if her skin is about to die. Jesus.
So why don't you bring in Allegra?
Can you please send in Allegra? Allegra, hi, Dr. Nassif.
Nice to meet you.
Hi, Allegra. Terry
Hi,
Dubrow.
nice to meet you.
Nice to meet you.
Dyson. I think Dr. Nassif and Dr. Dubrow, even though they're in the profession and they probably see hundreds and thousands of boobs every year, I doubt they see many like hers. I'm married to her and I wake up to her some mornings and I'm like, whoa, those are nice.
I know this may be a little unexpected, but we have a gift for you guys. A little bit of art.
Really?
Are you guys okay if I go get it?
She's an artist.
Oh my God.
Whoa.
So what do you think?
Oh.
Yeah, I
So
think
there's the asymmetry.
there it is.
Isn't that great?
Can
that
I see
for
it for a
you.
minute?
Absolutely.
Please.
That is craziness.
And stand up for a minute, please. Okay, there we go. Oh my
How
God.
do I look?
You wear them well.
Wait, hold on. Okay, ready?
Is it weird that I think my wife's breasts look good on Dr. Dubrow? Feel how heavy just the cast is.
So, I mean,
That
it
is
begs the
incredible.
question, how many cc's does this represent?
4,600 cc's
Seriously?
per breast, yeah.
Per breast.
Wow. This is actually a fantastic gift. I've always wanted a Golden Globe, and now I have 2 of them. How many breast surgeries have you had?
3,
And how many cc's was the original one?
800 cc's.
You went right to full size.
Oh, yeah.
And did you have any problems with it?
None.
What made you want to go bigger?
I just wanted more.
So you went into another doctor.
I did. I said, ultimately, I'd love to have 2,000 cc's.
Wow.
And he said, the most I think I can do is 1,700.
We have a term for doctors who put more than twice the recommended volume in a breast implant pocket. They are called insane. And what made you decide to do this?
I'm an envelope pusher. I love the way it looked. Yes, extreme. It just wasn't enough for me.
Right.
I found a doctor who did expanders.
Oh, and so they put a 2,000-ish cc tissue expander in, and then serially injected saline. How many times did it take you to get up to this size 4,600?
We've probably done like 5 or 6. I was doing a fill for her.
But you do it.
Yeah, I do.
Yeah.
You do it.
Yeah.
They give you needles and syringes and
Yeah,
saline
he
and have
writes
you
the
do it?
prescription, we pick it up.
Son of a doctor. I'm not really concerned. I feel comfortable that he knows. I trust him.
Just because you're the son of a doctor doesn't actually make you a doctor. Usually you have to go to, medical school before you can call yourself a doctor.
I'm not ridiculous in that I can't see that I need to be careful.
By the way, the careful ship sailed 4,000 cc's ago. That ship is on the other side of the world right now.
Careful on the crazy ship. How about that?
I'm not making calls about crazy. I'm just saying careful and risks.
Right.
Yeah.
Okay, so, but you're in to see us and you have a problem, right?
I do.
And what is the problem?
The issue for me is symmetry. I just absolutely adore the size, but I would love them to be more symmetrical.
I think that's the most important point to see what her tissue looks like.
It's exactly right. All right, so why don't we
Great.
go have a look?
Love it.
Okay.
Let's go.
So let's have a look at the situation. Okay, hello. So this is very firm, and this is much firmer
It is.
and much higher.
It is.
And here's the port right here. So this is where you inject on both sides, right? So do me a favor, put your hands on your hips and push. See if you can get them to wink. Yeah, so you can get them to move by
Oh yeah,
flexing.
I've got really good.
She's great at parties.
Is that right?
I'm a great party trick. Yeah.
It's important that I see how mobile Allegra's breasts are, because the less mobile they are, the more difficulty we may encounter when we get inside and try to manipulate that scar tissue. You do have obvious signs that the skin has been stretched to the maximum, and so when you see blood vessels that are dilated like this, it indicates that, they need help. If this is the limit, you're here. You've gone way over the
I was
limit.
just looking at these, like,
Yeah, this is the normal size breast implant. Your breast implant's poop bigger than this.
Right. I'm sure.
You know?
Oh, God. Seriously, Terry?
Poop? Poop. Really? So this one's encapsulated. Encapsulation means scar tissue has grown around it to protect everything. So the operation to improve symmetry is to go in and cut scar tissue. The problem is, if you take tissue that's under great tension,
Already.
it's having problems getting blood flow in, blood flow out, and you make cuts in it, you're cutting blood supply, you're thinning out the tissue, and you're exposing it to very significant trauma. I would bet you, if you did that first of all, you'd have problems getting this incision to heal. Do you know what's directly underneath that open tissue? The implant. Once the implant is exposed,
It's over.
game over, baby. Dunzo, over, bye-bye big breasts forever.
The worst case scenario for me would be losing my boobs, and I love my boobs. So living with asymmetry now, all things considered, I'm happy to live with it.
You wanna mess with this?
that.
I mean, especially right now, because right now your tissue is doing decent.
Tissue's alive.
Okay.
Take the syringes and throw them away.
okay.
Do you think so? Maybe?
Yeah, definitely.
Yeah?
Definitely.
You're the man. You're the
I had a
man.
feeling you would say that anyway, and I was
Yeah.
like, yeah, I'm ready for it.
It's a pleasure meeting you.
too.
Really,
Thanks.
truly.
Thank you very much.
Pleasure meeting you. Thank you. Allegra and her husband are really playing with fire here. They have to stop doing any more breast surgery, or they just may end up burning the whole house down.
We're good. We've kind of poked the bear enough now.
So the crazy train has to come to a stop and turn around, or just go another direction.
We're just taking crazy in a whole different direction.